Hello, everyone, and welcome. Thank you for joining us this evening. We are delighted to have you here for this exciting webinar, where we'll be exploring how DC supports reentry for our returning citizens. We're joined by panelists from multiple different DC agencies who are integral to reentry efforts in the district. Before we get started, I want to remind everyone that today's webinar is hosted by the Criminal Justice Coordinating Council, an independent agency that serves as a fulcrum for criminal justice agencies, federal and local, to work together to improve DC's justice system. We host interagency working groups, conduct research and analysis, and put on public meetings like this one today to support a functioning justice system. We thank you all for taking the time to be here for one of our sessions. A few quick housekeeping items. We have 8 agencies presenting today, so we have a lot of great material to get through. If you have any questions for our panelists, please use the Q&A function in the Zoom bar below. After a group of 4 agencies have presented, we'll have some time to answer some questions. Then we'll move on to our next 4 panelists and an additional Q&A. At the end, when you sign off, you will automatically receive a survey. Please, please, please fill out that survey. It helps guide us as we try to put forth webinars and information that best suit your needs. With all that said, we look forward to a productive and engaging discussion. Let's go ahead and get started. First up, we have the Director of the Mayor's Office of Returning Citizen Affairs, Talib Shakur.
Hello, everyone, and welcome. My name is Talib Shakir, and I currently serve as the Director for the Mayor's Office of Returning Citizen Affairs. It is an honor, it's a pleasure to be here today to just speak a little bit about what we do within our agency and how we help returning citizens navigate the reentry process back into the community. If you could move to the next slide, please. So just a brief overview of what we do exactly before I go into some of the details of the slide is our agency is made up of 4 components. Those 4 components is case management, workforce development, outreach, and peer navigations. And the way those 4 components work is that when someone is released to the community and they come to our office, we go through a case management process where we explain to them and ask them about what are their needs, what are their goals in terms of employment, housing, financial support, mental health support, and other stabilities that are needed after release. From there, that person is redirected to our workforce team, which goes through the list of all of the programs that we may have or may be in contact with that supports workforce development, whether that be through employment, sometimes it's through SNAP benefits, sometimes it's through educational programs. And then from there, our outreach team is the team that's responsible to making sure that those needs are met for the clients that come through. And we have a unique branch, which is our peer navigation. And our peer navigators are peer-led, meaning that these are people who've also been justice involved, and they help the clients every step of the way. The unique thing about Washington, D.C. and what we do is that we're not a state, we're a city, and our criminal justice system is kind of tangled up within the federal and the local system. So what typically happens is that someone goes to court from Washington, D.C., they end up in a federal institution. Upon release from that, they end up in a federal halfway house, which is often, at this time currently, just in Baltimore. So we're very unique in that we see what a lot of agencies don't see, that we see the coordination or lack of between federal, local, and private partners when it comes to returning citizens, which makes it a little bit of a challenge when we have to find strategic ways to coordinate between different agencies. However, as you see within the last 18 months, that we've served between over 7,000 returning citizens. Currently, there exists at least between 65 to 75,000 returning citizens, and on average, a year we serve about 5,000 of those returning citizens, people who are released from incarceration, immediate incarceration, or maybe within the 5 years of post-release. Um, so we've made a lot of referrals throughout the cities and throughout our partner agencies. So this is where you see the number of referred managed citywide, and that's through government agencies, also as well as through private organizations who really support the work in which we do. One of our flagship programs is the Georgetown University Paralegal Program, and we have at least 70 people who have graduated from that program. And that program is a very intense program, but it gives returning citizens the ability to become paralegals and to work within the legal field. Um, Next slide, please. So some of the barriers that exist within inside of the ecosystem of returning citizens, housing instability is a big one. Employment is a big one. Education and training and funding for those programs, and behavior health, meaning mental health and substance abuse needs are very acute. So with the housing is one of the biggest challenges, not just within Washington, D.C., but also nationwide. There are many barriers to housing outside of affordability. Some of the housing laws in terms of criminal background checks, credit background checks, many checks and requirements that a lot of our clients and people from this population just currently don't have access to. So that takes a lot of work working with property managers, big corporations to asking them could they be a little more lax in some of the housing rules that exist today in the District of Columbia. Employment, it's also been a gap that we've seen. How we have a program called Access to Job, and it's incentivizing employers to bring on returning citizens and to help pay the salaries of returning citizens or the people who come through that program. It's the Access to Job program. As far as employment, not only do we talk about people getting jobs or finding employment, but we also want to make sure that that employment is comparable to the national level when it comes to living wages, which can also be a challenge when a lot of people returning home from long-term of incarceration are not familiar with technology or how to operate the phones or just how to navigate through the city in itself. So sometimes employment has been a big barrier with when it comes to making sure that people who are coming home from incarceration have those employment needs met. Education and training. This is something that's also important. It's often overlooked that what we've been able to do is help people get IEPs, because a lot of times people have gone to the system not knowing how to read and how to write, and maybe have not developed those skills while on the inside. So we try to make sure that people have those exceptions when it comes to education and training. However, we want to make sure and ensure that those people who do go through our training courses or our educational programs, that those certifications or apprenticeships leads to meaningful and gainful employment. And most importantly, one of the biggest challenges of this whole discussion and conversation is the mental health needs and access to those mental health needs, viable mental health needs. And that's been something that we've been doing as of late to make sure that the programs that we are connecting people to and that we are referring people to have access to actual, like, real substantial mental health services, whether that be through a therapist, whether that be through a continuation of medication and medicines. So that's kind of some of the barriers that we see and the challenges within our agencies. Next slide, please. So here's where we headed, and here's where we need the biggest support and advocacy from. Um, so the way that the program, as I just laid out with the case management, workforce, housing first, family, community, reintegrations, mental health and wellness, um, We need to come up with a system where we're not working within silos. And this is one of the biggest problems that we have nationwide, that we have so many great programs, so many great partners, but oftentimes the organizations don't know who's doing what. So if sometimes it make it a bit of a challenge to refer people to the correct resources that they need. And so I think, we need to find a way to come up with a system that unifies and bring all these different partners, agencies together and to streamline the process so that everybody's working within the same ecosystem and not in so many different silos. When it comes to workforce, we need to make sure that not only are we teaching people CDL, GED, and sometimes we have tech boot camps, AI, coding. For example, we need to make sure that those jobs or those trainings lead people to jobs. It doesn't just stop at the training level or the apprenticeship level, but there's actual access to employment after the completion of those workforce programs. When it comes to housing, um, this is one of the biggest challenges I've mentioned earlier, and I think that this really takes legislation. A lot of legislative changes need to happen in this field. We need, more attorneys to ensure that people are not being discriminated against because of their criminal background or having lack of credit to show when it comes to housing, and to also make sure and ensure that we have more than just temporary housing, that we can find more permanent housing. And in often cases, we need to make sure that that permanent housing can sustain families, because we have women who are also released from prison and they have families. So we want to ensure that everyone is being covered with that. We also need to figure out a way to build better communities and enhance the family reintegration process, which requires a lot of peer support, leadership, training. One of the biggest things that we found when it comes to people sustaining and remaining uh, 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 um, free after post incarceration is that they go into really healthy, strong, viable communities, and they have those supports built in the structure in those communities. And lastly, um, I would say that we need to think more about what mental health looks like, and how to really separate um, general traumas that people may experience to more specific, specialized traumas when it comes to mental health, and how we are treating people and dealing with people who have suffered from not just extreme cases of mental health, but even some of the anxieties and the depressions that people fall into post incarceration. And I think that's something that we've been very adamant about, and something that we want to keep our focus on. So we need to expand that triage, and we need to look at coverage and what that looks like with Medicare, Medicaid, and we need to have more peer-led services where people who experience those situations can be involved in the healthiness and well-being of other people. Um, and just lastly, just as a closing remark, is that when we talk about reentry and what that looks like, it can't just be a policy, it has to be something well structured and well thought out.
Thank you, Talib. I think that's great information and really sets kind of the tone for what is necessary for, successful reentry. What elements are fundamental to a successful reentry, and it was great to hear about the work that Morka is is doing. Next up, we are going to move over to we have the Associate Director for the Office of Legislative, Intergovernmental, and Public Affairs at CSOSA. That's Mr. Cedric Hendricks. And whenever you're ready.
Well, good evening. Thank you for the opportunity to participate in today's public meeting. I am also, I think, delighted to be part of this broad panel that includes many of the organizations that we at CSOSA work with daily. I'm also proud to follow Mr. Shakur. I have met with him a couple of times, and his office is located right across the street from one of our larger offices. So we uh, do work with him and appreciate the communication and collaboration that we have. Now, I've been at CSOSA about 25 years, and from my beginning at the agency, reentry has been a matter that has stayed at the top of my agenda. Some may remember that back in the day, we began taking trips to Rivers Correctional Institution on a regular basis in order to connect with the men down there and provide resources and services. And um, because that facility ultimately closed, those trips have ended. But we have been fortunate to have some of our staff participate in the institutional visits that Morca has been doing over the years. We used to take a wide array of community partners on these trips with us, and I think partnership is something that we have found helps us to help the people that we have under supervision. Housing, healthcare, education, and employment have long been the biggest challenges of men and women under supervision. And let me just say too, it's important to know that 68% of the men and women under supervision at CSOSA are on probation. Um, 16% are on supervised release, which is a type of post-incarceration supervision, and only 4% are on parole. And so one can think that, well, maybe we don't do a lot of reentry because that 68% of the population is on probation, but those men and women on probation supervision face the same challenges for the most part that the men and women coming home from prison do. Again, housing, healthcare, education, and employment. And so we try and address those, what we call stabilization needs, in a structured way. For example, we have a housing program. Mr. Shakur talked about how housing is a great need. I remember the first time we met, you talked about how, many of the people that come in your door express that as the first need that they have. We have a supportive housing program. We have about 80 beds under contract that we're able to move people into. But the term of those stays is limited. 90 days, maybe up to 120 days, but then we have to move people on because there are others in the queue that need that initial placement. So we have, uh, endeavored to work with other providers in the community like Jubilee Housing, like Community Family Life Services, so that when folks finish their time with us, they have somewhere stable to go. That remains a level of great need for all the folk we have under supervision, and again, we're investing in that, but there's a greater need now. Mr. Cure also mentioned employment, and we have a number of staff that work with our supervisees on employment and training. I think many of you all know Tony Lewis, who is our lead vocational development coordinator. Uh, and he and his teammate Michael Bonds have worked to build a strong relationship, most recently with the Federal City Council, which has connected us to something called DC Builds DC.
Mhm.
That is a group of construction companies that are engaged in a number of projects around town, and we have been fortunate to be able to work through them to get people hired. Also, through that federal city council relationship, we've been successful in the hospitality arena, in particular with hotels, and we have gotten people into those jobs. Those two areas have been I guess, areas of promise for many of the folk under supervision, but not everybody wants to do that. We have worked with folks like Raymond Bell, who many of you know has the Hope Project, who's done a stellar job getting people into the IT field.
Mhm.
Um, we've taken advantage of a couple of the programs that Mr. Shakur mentioned, the Georgetown Pivot Program, as well as the Georgetown Paralegal Program. I am also proud to say that most recently I was able to attend a graduation at DC Central Kitchen, and the uh, the classes that they graduate always have some of CSOSA's men and women enrolled in them. I think we had 6 in the last class. Another city program that we take great advantage of is the Pathways program that's operated by the Office of Neighborhood Safety and Engagement. Just went to their graduation, and we had, I think, 5 graduates amongst that group. So through these various partnerships, we are trying to stay connected to structured programs that are productive. And I have to say, though, that the need is even greater than what they can provide. So, to underscore what Mr. Shakur said, we are anxious to work with anybody out there who is committed, has structure, resources, and are willing to work with the men and women that we have under supervision. They have abundant needs, but they are from this community, and we have to count on the resources in this community, the natural systems in this community. That would include the government, both federal and local, as well as the faith community to help meet those needs. Let me just close by talking about the work we've done over the last 20 years with the faith community. Some may remember that in 2002, we launched our faith-based initiative and recruited faith institutions from across the city to provide mentors from within their congregations to work with those under supervision. That program continues today, not as robust as it once was, but nonetheless, particularly as it relates to men and women coming home from prison, they're often estranged from family, and we've been through that program able to connect many with faith institutions that provide stabilization support and mentors. So we're going to be putting together an event that comes later this year in September. We call it Call to Action, and we will once again be reaching out to the faith community, seeking to tap into their varied ministries as well as into the members of their congregation for mentoring services and support. So I'll stop there and be happy to take any questions when my time for that comes.
Thank you so much, Cedric. And I think really one thing that you highlighted there that I really appreciate is the commitment to collaboration, to partnerships. We know that we have all of these different agencies. There's always a concern about siloing, but I think one of the best things that you highlighted that CSOSA does is, working hand in hand with these other agencies in DC to make sure that they work together and support returning citizens. So thank you again, and we will kick back to you later. Right now, I want to introduce from the Ready Center through the Department of Corrections, Clarence Boykin and Charles King, who are going to present to us about some of the work that they're doing at the Ready Center. So whenever you're ready.
I'll start off and my colleague will interject as needed. I'm Charles King. I work for DC Department of Corrections at the Ready Center. I currently work in the reentry space at the Ready Center. I am a returning citizen myself. Working in this space has allowed me the opportunity to engage with others who are currently returning citizens and connect them with a multitude of different types of services. I believe that you have our PowerPoint up, so if you can start the slide and go to the first page for me, I'll be more than grateful. Thank you. So at the Ready Center, we have a host of different partners. The Ready Center serves as a consolidated hub or one-stop shop where formerly incarcerated residents re-entering the community come to access vital resources and service offered through a host of community-based organizations and district government agencies, including the Department of Corrections, the DMV, DOES, DHS, the Mayor's Office of LGBTQ Affairs, Department of Behavioral Health, DBH, the Bureau of Prisons, DC Public Library, the Mayor's Office of Latino Affairs, the Office of Veteran Affairs, the Mayor's Office on Returning Citizen Affairs, and Office of Victim Services and Justice Grants. And we do have more, but those are just some that are other agencies that are government related, but we do work with other community-based organizations that revolve on a daily basis in and out of our office throughout the week um, while we're providing service. If you can go to the next slide for me. The mission of the Ready Center is to support returning citizens within 12 months of release. So we have extended our support at the Ready Center. It was once 6 months. For all on the call who don't know, the Ready Center has extended those services for up to 12 months. So returning citizens who are DC residents can come to the Ready Center and receive services for the first 12 months of their release from the day of their release. Our mission is also to reduce recidivism through coordinated services. We are building strong partnerships with anchor organizations. We provide seamless navigation across critical life domains. Also, outside of this, our mission is to engage with also family members of individuals that are incarcerated. We do put on workshops for families. We do hold community events for family members of incarcerated individuals as well as for those individuals that's incarcerated. We recently just had a resource fair where we provided a host of different things throughout the course of the day on last Thursday. And we try to make sure that we provide that information to all agencies and that we notify the general public that all are welcome to come and participate. If you can go to the next slide for me, please. How to get to the Ready Center. The Ready Center, we have a shuttle bus. So our free shuttle bus is provided 9 to 5, Monday through Friday, round trip transportation for newly released individuals who are returning to the community from DC Department of Corrections. When they're released from DC Department of Corrections, they have the opportunity to take advantage of the free shuttle bus that we have that's located there. We also have from the jail, from the Ready Center, we also have quarterly opportunity fairs and training at the Ready Center. We're also equipped with providing rides from the Ready Center to multiple different locations that are free. We have several locations that are free for transportation, which are Union Station, Morka, DC Department of Behavior Health, Howard University Outpatient Center, DMV Adjudication Services, and Voices of a Second Chance. So if there's an individual who needs to get transportation to one of those services, we do have a van service that is available there. And we try to make sure that those vans are on standby at all times and are readily available, especially for those who might need rides back to Union Station for accommodations that try to make it back to the halfway house to catch the train from Union Station. Can you go to the next slide, please? The Ready Center Metro access to the Ready Center. We have the Metro Rail, which is the Green Line, which is in Congress Heights Station, which is right around the corner from the Ready Center. The Ready Center is located at 3640 Martin Luther King Avenue. Congress Heights Station is located maybe about a mile away, a little bit over a mile away on Alabama Avenue in Southeast Washington, D.C. at the St. Elizabeth campus. We're also on a Metro bus route, which the C11 stops near the Ready Center, directly in front of the Ready Center on the side of the Ready Center, and about a half a block up from the Ready Center on the opposite side of the Ready Center, there's a bus stop that'll let you off so that you can get to the Ready Center if you're riding the C11. Can you go to the next slide, please? The Ready Center organizes services across key domains: mental health, mental behavior health, physical wellness, education and employment, financial, family, legal, and community and creativity services. We provide those services on a daily basis. We have different providers that we work with that are community-based organizations as well as other government agencies that assist with providing those services at the Ready Center. As stated earlier, the Ready Center is a hub. It's a one-stop shop for individuals who may be returning citizens to the community. They can come there and receive those services Monday through Friday from 9 to 5. Can you give me the next slide, please? As you see on the screen, you see the logos for some of the partners at the Ready Center. If you look at those different partners, those are just some of the partners that actually are government agencies that work with the Ready Center, but there's much more partners than that. We have a list of partners that varies on daily basis. We're adding new partners on a daily basis. We have partnerships and we do offer tours to the individuals who may be looking to partner with the Ready Center, and our doors are open and welcoming to anyone who may be available to help provide services to individuals who may need the services at the Ready Center. Can you go to the next slide, please? So we have a core service, a group of core services at the Ready Center. These core services are offered at the Ready Center on a regular basis. And if you look at the screen that's currently up, these core services consist of SNAP and Medicaid enrollment, which will be a DHS. We have educational services. We have vocational training in demand industries, such as the Bennett Institute. We have a couple other services that come and rotate throughout the building throughout the course of the year that offer vocational services. We have housing navigation, um, and we have housing navigation also where we work with Jubilee Housing, we work with Catholic Charities, we work with Samaritan Ministries, and several other organizations that actually work with housing such as Far Southeast, Voices of a Second Chance. We provide employment opportunities. Over the last 65 days, in the course of 65 days, we had a total of 272 people come to the Ready Center and had the opportunity to meet with employers for Second Chance Month, as well as we hosted a job fair about a week, maybe about in June, I believe it was, for the construction industry where we had individuals come in. So those are some of the employment opportunities that we have that we host, but we do have opportunities where other individuals may come in seeking employers in the food industry, hospitality, and things like that. We also have a DMV at our location for DC non-drivers IDs for individuals who are coming back to the community from being recently incarcerated, who may not have identification, but have a DC jail ID card. They can use that ID card to come and get a temporary 6-month ID at the Ready Center, or they can come to the Ready Center with their birth certificate as well as their temporary ID and speak with the Hope Foundation, which is in our building, and get an address voucher and get an 8-year ID. We have counseling and support groups. Those counseling and support groups are always available. If an individual comes to the Ready Center seeking those services, we will connect them with those services. We have DBH there in order to start that process if that process is needed. We have substance abuse treatment at the Ready Center, which one of the substance abuse treatment is hosted by the Hope Foundation, which is a foundation that is anchored inside of the Ready Center, and it is also working with individuals dealing with substance abuse issues inside of the facility. We're dealing with vital records assistance. We'll do a referral for vital records, and usually we'll work with MORCA on that, trying to get individuals their vital records or Voices of a Second Chance, or we'll try to connect the individuals with the appropriate agency that may be able to assist, especially with individuals who may need vital records, but they're not from the DC area. Can you go to the next slide, please? The Ready Center serves residents released within the past 12 months, DC Department of Corrections, Federal Bureau of Prisons, and other correctional facilities. So anyone who's a DC resident who was released back into the community and they're coming from DC Department of Corrections, we can verify that they was just recently released through our system as well as through the FBOP. If they're coming from another jurisdiction, we just ask that those individuals provide proof of returning back to the community from that jurisdiction, a release paper or something indicating that they were just recently released and they can come in and receive services. Can you go to the next slide, please? So we have a Ready Center intake and pre-release engagement. I'm a community outreach specialist, so I usually go into the facility when I do the pre-release, where we also accept walk-ins. Walk-ins are welcomed. You don't need an appointment. Excuse me. You can come to the Ready Center on any given day that we're open and walk in and receive services as long as you're within that window of coming home within 1 year. Some partners do require appointments, but to come into the Ready Center, you're eligible just to come into the Ready Center. Once you get in there, and you may speak to a partner, that partner may tell you at that time that they need to set an appointment, but our doors are open at all times for individuals to come in and at least at the bare minimum seek services. Pre-release engagements, like I said, I meet with the residents while they're in the DC Department of Corrections. If they're interested, I'll get them to complete a intake screening form, and once that form is completed, I'll usually key that information into the system. One thing that was left off the list that I can bring to your attention, we also engage with individuals from the Federal Bureau of Prisons with going out to those locations with MOCA and providing that information to individuals or DC residents that they are eligible to come to the Ready Center upon their release. Can you go to the next slide, please? So we have frequently asked questions about the Ready Center. One of the most frequent asked questions is, can I walk in? Yes, walk-ins are welcome. Do partners require appointments? Some do, DMV, DHS, etc. Sometimes their load is light. They'll be able to take an individual on a walk-in. Sometimes you may need an appointment. One of the next questions that individuals ask is, can I get help with housing or employment? Yes, we do navigation, referrals, and direct connections. Based on services and availability, we will connect individuals with those services that need them. How long after release can I receive services? As I said, the time has been extended as of recently. Our deputy director extended that time to push it up to 12 months because we understood that some individuals most definitely need more than 6 months of support, and we realize that the transition back into the community is more stable and it's more powerful and more impactful with that extra 6 months being added on. Next slide, please. So the Ready Center serves as a consolidated hub or a one-step where formerly incarcerated residents re-entering the community come to access vital resources and services offered through a host of community-based organizations and district government agencies, including, as I said before, in closing, I'll repeat, those agencies are the Department of Corrections, the Bureau of Prisons, Department of Motor Vehicles, Department of Employment Services, Department of Human Services, Department of Behavior Health, the Mayor's Office of LGBTQ Affairs, the Mayor's Office on Returning Citizen Affairs, the Mayor's Office on Latino Affairs, the Mayor's Office on Veteran Affairs, DC Public Library, and more. And that will conclude our presentation, and we'll be on for any questions that anyone may have later on in this segment.
And Adam, yeah, just in closing, excuse me, I did want to just mention that, at the heart of the Ready Center mission is that we do believe reentry is essential to public safety, community well-being, and just a basic human dignity. It's the heart of what we do. Reentry is a critical bridge when you think about incarceration and becoming true community members. As it's determined whether returning citizens can move forward from surviving to thriving. One of the things we, focus on at the Ready Center is that, when people come home, we want to make sure we face the immediate barriers to housing, employment, healthcare, identifying those legal issues that may not or cannot overcome alone. The Ready Center, again, is that one-stop shop where people can come and get those necessary resources. And we're just truly excited about what we do as far as investing in a strong reentry services, reducing recidivism, and improving public safety. And we just want an opportunity to share that. Thank you.
Yeah, thank you. Thank you both. Thank you for that great presentation. Again, I think you really touched on some of the key issues that we're often hearing, right? Employment, access to IDs, housing access, housing support, and healthcare as well. Those are some of the most common things we're hearing about, and it's great to see the work that the Ready Center is doing in those areas. Next up, we have somebody from the Public Defender Service. We have Mr. Reginald Williamson, who is a staff attorney for the Prisoner and Reentry Legal Services at the Public Defender Service. So whenever you're ready, please take it away.
Adam, thank you.
Good evening, good afternoon, good evening to everyone. I am Reggie Williamson from the Public Defender Service, a staff attorney, as Adam has indicated. Um, I We are located at 1442 Pennsylvania Avenue Southeast, around the corner from Potomac Avenue Metro stop, and right next door to New York Pizza. We have walk-ins and telephone duty day every day. In our office, a lawyer, either myself or one of my colleagues, are on duty to field a question or inquiry by anybody with respect to reentry. On and also it could be with respect to on the prisoner side as well. Someone may come to the office or have a question with regard to a loved one who may still be confined in the BOP or at the DC jail. On the prisoner side, one of the main things that happens at Prison and Reentry Legal Services for our brothers and sisters in the DC area who are at the jail is representation at adjustment board uh, uh, hearings, where someone may get an infraction or be charged with an infraction at the jail. And so this obviously is for someone who may know someone who is at the jail, and they may have got an infraction or a charge with respect to some conduct at the jail. We provide representation for that person at the jail before the adjustment board. That's pretty important because depending upon what the person may have been charged with at the jail, it could possibly turn into a case in Superior Court. And so that's important to us. We don't want that. People already have or are dealing with something, and that's obviously why they are at the jail anyway. So we do provide that representation for folks who are at the jail or who may get hit with a DR or a disciplinary infraction, a disciplinary report. Also, with respect to conditions at the jail. The situation may be someone is not able to get their eyeglasses, or they're not being provided a diet that they have chosen for religious reasons, or they are not getting their medicine, what have you. If the person has an issue at the jail, they certainly can contact PRLS, and the lawyers, particularly one particular lawyer, can look into those prison conditions as well at the jail. On the BOP side, or also on the prison side, but for the Bureau of Prisons, we also actually this is also community for folks who have come home and who are on some type of supervision, be it parole, if they have an older case, or be it excuse me, my sinuses are acting up, or be it supervised release. The lawyers in Prison and Reentry Legal Services will represent people before what is called an early termination hearing for the United States Parole Commission. If they're on parole or supervised release from their conviction, a DC conviction, and they have been home for a certain time, and particularly in the parole context, they may be entitled to a hearing for the Parole Commission to seek and to argue for early termination of their supervision, so that they don't have to continue being on supervision as they are home, particularly if their conviction netted or has a life offense. We will represent them before the Parole Commission and argue that this person has done well. They have tested negative. They go and see their CSO. They're working. They don't have any issues. They actually have been doing really well on supervision, and therefore they indeed should have their supervision terminated early. The hearing aspect occurs only in the parole context, and that's not available in the supervised release context. The remedy for early termination in the supervised release context is a memo or memorandum or a well-worded and detailed writing to the Parole Commission arguing why this person is indeed should have this, why this person should have their supervised release terminated early. And that is something that we do as well. If the person has been home and is on supervised release. Generally, the point in time that separates the two is essentially the year 2000. Is your conviction before 2000 or is it after 2000? If it's after, we're talking supervised release. If it's before, we're probably talking parole. That's loosely, roughly the case, but it's certainly something that will be looked at by the lawyer who may be handling the case. If there is a person who is on probation, who, when they got sentenced by the judge in Superior Court, and they did not get a sentence of confinement, or the sentence of confinement was suspended, and they have a period of probation, therefore they're still before or under the authority of the judge in terms of supervision, the same service applies. They can come to the office and we will look into early termination of that supervision. And that will certainly have to be.
You muted yourself, Reggie.
Okay, I just got. Okay, all right. A note had popped up about muting. Another one of the main things that we also do now is record sealing. But the service for the record sealing has entered a new phase now, if you will. And so while everyone in the District of Columbia, particularly when the law had changed and made record sealing more available, more streamlined, if you will, it also made more offenses eligible to be sealed. And everyone has been coming to the office and has been seeking record sealing. So I would just say, still contact the office and you'll be provided with an answer in terms of whether or not whether or not we a service that we can provide or one of our other options. What do I mean by the other options? There are some other organizations in DC that provide the record sealing service as well. We also have what we call our Pro Se record sealing toolkit. It is created to afford a person to be able to file their motion to seal on their own. And it is laid out from A to Z, from start to finish. And obviously if a person decides to go that route of filing their own motion, certainly they can contact the lawyer on duty or myself if they have a question in terms of pushing them through getting them through the process. In fact, maybe a couple of months ago, we had an event at the Big Chair in Southeast in which we simply set up, it was a kind of a pop-up. We set up a shop with lawyers and the computers and everything necessary. It had people come out. We ran records and prepared motions or helped them prepare motions to seal on the spot. And people left with their motions in hand with instructions as to how to go about filing it, making copies, what they needed to take to the courthouse, whether or not they wanted to file it by email or mail it in, or walk it in themselves. And so, in fact, a lot of people have, in fact, since we had that event in Southeast, have filed their motions to seal. So that's something that's still available now, even though there's a transition period, if you will, with regard to the record sealing. You should still call, and we will certainly let you know what can be done, what is available. The mission, the main point, the purpose with respect to our office is we try to take a look at what is prohibiting or obstructing or getting in the way with respect to a person who's trying to move forward with their life, and the criminal record is getting in the way of them moving forward. that is preventing them from being able to realize their dreams, their ambitions, their goals. That's where we believe our purpose is and where we come in. We attempt to get that obstruction out of the way. And so that's our main focus while we're in sort of somewhat of a, as I say, a transition period. So my hands are tied a little bit in terms of the things that we can do and what I can talk about in terms of what we're doing now. So remember that we have duty day and walk-ins every day. The number, our main number here is 202-824 2801. 202-824-2801. My cell is 202 480 0348. 202 480 0348. Give us a call. We'll come to the office and sit down with one of the lawyers, and we'll talk about that issue that may be getting in a person's way in terms of moving forward in their life, despite the fact that there is a criminal arrest or a criminal conviction. And with that, I'll certainly shoot it back to Adam, and then we'll be available for any questions that someone may have.
Yeah, thank you. Thank you so much, Reginald. And I love the focus or at least the mentioning of some of the work that you all do on record sealing. I know when we hear about second chance hiring and we hear about some of the barriers that keep individuals with records from finding employment and other services in general, having that record out there is often a big one. And so record sealing can be just incredibly helpful in that space. We've heard from a few folks. I'm gonna call them back to the screen because we're gonna do a little bit of Q&A before our next panel. One question that I've received, and if you have questions, folks, please put them in the Q&A portion on the Zoom screen. It should be in the bottom of your screen. One question we received from the audience is, how do you know that your reentry efforts are successful, right? How are you measuring success for supporting returning citizens? And that one's really open to the group.
Yeah, so that's a great question. And one of the things that we actually focus here at the Ready Center, as we mentioned, some of our in-house partners are DOES, Motor Vehicle, and DBH. And one of the things we do is we actually track the referrals that are sent the prior month. So the 5th of each month, we get a report back from those partner agencies, the results of those referrals. And so we're able to see if that returning citizen actually, follow through with the appointment that was scheduled, or what was the result of that interaction. So we need to know if we need to get back in with a second call or some type of other formal resource. So we actually have a system in place that we do track the referrals that we send, and we do that also with community-based organizations. And then I think one of the things we also do is we use our services to wrap around the entire family. When we think about reentry, it's not just that individual, but the entire family. And we have what we call a family advisory committee. And we use that committee and we get the input of those family members. What are they struggling with? What are some of the areas that they need help in? So again, we make sure we have targeted efforts to really resolve problems and get the feedback as far as solutions when people are asking for help. And just to give you an example, children of incarcerated individuals over the Christmas holidays, it's a struggle. We partnered with the Wizards and was able to provide over 1,000 gifts to children of incarcerated individuals. So those are ways in which we measure results of the referrals and the work that we do here at the Ready Center.
Does anyone else want to take that one as well? And thank you,
Yeah,
Clarence.
yeah,
That was great to hear.
I chime in a little bit on that. That's one of the biggest challenges when we talk about reentry. How do we actually measure those results and what those results look like? Um, because first and foremost, like what is actually reentry and what is a returning citizen, right? I mean, the conversation as to how long does the reentry process actually last, and at what point does a person transition from being a returning citizen to a regular citizen, right? So there's a lot of confusion in that. And so sometimes people may be caught up in the reentry process for 6 months. For some people, it's 6 years. So I think that's one of the bigger conversations that we should have overall. Like, what is the term and time limit of reentry, and when does someone actually stop be labeled as a returning citizen? In terms of one of the things with our office that we have council oversight. So council has oversight of our office. So we have KPIs, we have data reports. So we have systems in place that we held accountable to. So it also means that when we do the referral, that there's a tracking mechanism as well. Oftentimes, because of the establishment of the agency, when those referrals end up at a dead end, oftentimes the clients, they will come back and we'll revisit that. So, it's really the way that we're actually tracking the referrals and how are we, what's the response? We have surveys when we're asking people, are we doing a good job or we're not doing a good job? Or have you gotten the services that you need or you haven't gotten the services that you need? Our peer navigators, they do follow-up calls. And oftentimes we find out that there was a gap that someone fell into. So I think that is a really great question. Like, how do you measure that? How do you track that? I think that to become more specific with that is first understanding what is reentry, the term of reentry, what does that look like? And when does a person transition from being a returning citizen to, just a regular law-abiding person? And so I think we had to figure out those dynamics from the perspective in which the chair in which I sit in.
Can I just one thing, just because we did receive another question in the chat that I think is a tie into this one, which is how often do folks in the collective group here survey clients as to the effectiveness of the services? And it sounds like I think one of the things that's being asked there is that one of the ways that you're tracking success? Are you, is there a feedback loop for that kind of information?
Yeah, like, once again, I know that what we do, we have surveys. And so we try to be very transparent and we ask people to be transparent with us. So through our survey mechanism, when people come in, we do ask them like, what can we do better? How can we do better? Are we connecting the dots? So and I think this is the conversation that all of us that's work with in this work that we do talk about, how are we measuring our success and is it really effective or not? And if not, what are we doing or what can we do to improve upon that success rate?
Yeah, so as Mr. Shakur mentioned, we do too. Here at the Ready Center, we have a survey that we ask individuals to complete upon leaving or receiving services. And then we, just in real time, we have people who show up, just released from the facility, and we are able to provide clothes and things of that nature in real time, and we get that feedback. We have a system called Apricot that allows us to track the referrals that we send to our different partners. And through that system, we're able to get the feedback based on the notes that they put in once they receive that referral. So we're big, as Mr. Shakur mentioned, on, trying to really make sure that the services are being rendered. We provide a lot of referrals, and we want that feedback to know that we sent the person to the right person, that it is working, and vice versa. As people refer people to the Ready Center, we want to make sure that we're providing, exactly what they need. So I think those are the things that we've tried to put in place, and we continue to, work on and improve on those services. So as he mentioned, for us to be able to get together and continue to do that. But I do think we have a foundation when we think about the system that we use here called Apricot allows us to really track it in real time.
Mr. Williamson, is there anything you wanted to add? I know you were inclined to jump in before.
Adam, I'm gonna hit it briefly from
Sure.
the other end. So no, not a formal survey, if you will, to get a gauge, a temperature of whether or not, and I'm going to personalize it, whether or not I am being effective. But what lets me know that, the boots are hitting the ground is first of all, the client reaches back to me once they have gotten home. And they're telling me, what's going on, what have you, and they're dealing with supervision and they're doing what they're doing. But what really connects with me is in terms of whether or not what we're doing or what I'm doing is effective, is their stick-to-itiveness. If there probably is not a word, but I just made it up. And what I mean by that is folks are they're grabbing hold despite the fact of what they've been through. And I know that there's some people on this call know better than I, or know better than some other folks, because they lived that life. Reentry, from what I can tell, is not easy. It is, what I can see, it is hard. And the statistics are out there to indicate that you are not supposed to make it. You are supposed to wind back up in a place where you don't want to be. And so when I hear from, and I got a few folks, it warms my heart because they are determined. They are sticking to it. They are fighting. Despite the challenges, they're trying to get a job. They end up getting a job. They're caring for their families. They are dealing with the ups and downs of relationships. And so when they call and we talk about this, it lets me know, okay, all right, so the effort has, it has some value. And so that's the sort of the feedback that I get to share with, staff and my colleagues, and they have the same, stories as well. People who come home and who appreciate what we may have been able to do, and it gets shown by them sticking to it. They are finding, and some indeed, as Brother Shakur talked about, a difference between returning citizen and becoming that regular citizen. They have reached that threshold. They have crossed that valley, if you will. They're now, life is getting rather regular for them. And sure, there's stuff still in the rearview mirror, but they're determined. And so I suspect there are many folk on this call who have the same story to tell, but that's one indication that where I have found that what we're doing is having an impact, whether or not folks have just given up or whether or not they're still fighting and they're still trying.
Well, that was great, and thank you so much for that perspective. I think that's a great place to leave it with this slate of panelists. So I do want to thank you all for the information you provided. For our audience, please do stick around because we have quite a few more panelists today who are going to be speaking about resources that are available in the community. And next, we have the Special Assistant at the DC Office of Human Rights, Mr. Charles Thornton. Whenever you are ready, take it away. I will share that slide that you sent.
Please do. Good evening, everyone. It's definitely a pleasure for me to be here. Good to see so many of my colleagues and friends online. And again, it's a great pleasure to be here. I told Adam I was going to keep it short, but I must say I'm just as excited about reentry today, as I was when I was released on early parole. Not supervised release, early parole, as Mr. Williams was talking about, which pretty much says a little bit about your sentence. I was released on early parole in 1992. I paroled in 1990. So I've been out here now 36 years. And I'm as excited today as I was 36 years ago when I was released from, Lawton. And well, I'm going to start with the landscape in the 1997 Revitalization Act. It's been said by some of our colleagues, the landscape today. But as we know, as a result of the Revitalization Act, close to, close to 10,000 people was transitioned out of Lawton into the federal system. And that's been quite some time ago. But today, there's around, a little over 2,600 people right now in the federal system. And that says something to me. Close to 10,000 was released. But today, there's, a little over 2,600. I am the special assistant at the DC Office on Human Rights. We enforce the district's human rights laws. And that's important. The Office of Human Rights was established in 1977. So it was established right around the time of Home Rule. And there is several laws that the office actually enforce. But what I'm going to talk about is laws that are specific to what we've been calling returning citizens, today. I was listening to Talib in reference to, when do you go from a returning citizen to a regular citizen? And as one who, was around and kind of navigated a lot of the terminology that existed, especially from many, many years ago, Cedric, I seen Nancy on here, people like that will remember when we were, looking at ways to express ourselves. And when I say we, or how we wanted to be, expressed from other people, we were addressing, negative terminology like felons and things of that nature. And that's where all of this language came from, to be, so that we could be expressed differently. And I watched it go from, formerly incarcerated people to PIPs, all the way to where we at now. But it's an individual thing. And you are a citizen when you decide that that's what you want to be. So you don't have to, it's no time frame, to go from previously incarcerated to, it's all on what an individual, it's an individual thing, So that being said, one of the first legislations that was introduced that really was specific to, in my opinion, reentry and returning citizens was in 2012 when Councilman Harry Thomas introduced the Public Employment Inclusion Act. And what that specifically did, that was what, we referred to as ban the box, and when the DC 2000, which was the job application back then, asked the question on that application, have you ever been convicted of a crime? And the Public Employment Inclusion Act changed the application. And it's public employment because it was a law for government. The DC 2000 was for government employees. But, I will say the outcome of that in 2012 was that a lot of the agencies, the government agencies, back then, typically you had a lot of individuals with DPW, that had criminal backgrounds. But this opened the door to some of the other agencies who today have a wide amount of individuals with criminal backgrounds. I'm talking about places like DDOT, DGS, DPR. These were agencies that typically DPR, weren't, the door wasn't as wide open as it is now for formerly incarcerated, individuals to get hired. But just as a direct result of the Public Employment Inclusion Act, which was introduced again by Harry Thomas in 2012, there was over 1,200 individuals that gained employment opportunities in those other agencies that I talked about. Again, it was very common for people to be at DPW, but very few at DPR. That's changed. That's changed a lot. The other, and in 2014, Councilmember McDuffie, he expanded it. He expanded the, and he introduced the Fair Criminal Record Screening Act. And what that did, it changed the two things. One, it changed the ways in which a person was hired at the interview process, right? Not only did it remove the box, and not just from DC government applications, but from all applications in the district, all employers right now are bound by the Fair Criminal Record Screening Act. And that law is enforced by the Office on Human Rights. And what that looks like is that if you receive an application today from anywhere in the district, and that application has on it a box that asks the individual, have you ever been convicted of a felony? That is a violation of your right. That is a violation, and it can be enforced through the Office of Human Rights. All you have to do is bring that application to the agency, send it to the agency. I mean, we're working on, employers right now today. Now, full disclosure, you have to have more, the employer must have more than 10 employees, right? And there are a few covered employers who work directly with children are exempt from this law. Employees who work specifically with seniors or individuals who have mental health issues are exempt from this law. But outside of that, everyone is, and there are some federal employers who are exempt. But for the most part, all contractors, employers, businesses are bound by this law. And as a result of this law, I've seen multiple businesses abide by it, remove the box, and has led to individuals getting jobs where applications at one point may have been thrown in the trash just by the mere fact that it had the box on it. Then the other thing along that this law provides is that you can apply for a job. You can apply for a job with these employers, and they know not to ask you about your criminal background, which is important, until they have made an offer. So after you receive that offer, then they can, do the background check, which kind of, raises the playing field a little bit. Now, if the job is rescinded as a direct result of your background, then it also, requires that there must be a rightful relationship between the job that you have applied for and the charge that's in your record. For example, if you if you applied to be a bank teller and you have multiple bank robberies in your record, then they have a right to rescind that. But if you apply to be a cafeteria worker and your job is rescinded because you have a marijuana background, that's not rightly related to cafeteria work. So you have an opportunity to, your rights have been violated. And that's a case that the Office on Human Rights can pick up. So in 2016, Councilman McDuffie also extended that. We've had several people talk about housing being a barrier on the call today, several of my colleagues. So the Fair Criminal Record Screening Act for housing was introduced in 2016, and it has some of the same provisions in terms of not being discriminated against from putting in an application, and not being able to ask about your background until the unit is offered, until there's been an offer for housing. Then they can do their background search, et cetera, et cetera. I'm a somewhat yield. I know we got a lot of other people speaking, but the last thing I put on this slide was the restore the vote that was passed in 2020. A lot of what I'm talking about is legislation, and one of the things that as a formerly incarcerated person, returning citizen, in the district, and in most cases, you'll hear people say reentry starts prior to coming home. Reentry starts at your sentence. Reentry starts when you're sentenced, prior to even being introduced back to society is when reentry starts. And the idea that, not the idea, the fact that DC population is allowed to vote in the federal system, in the local system, that's a right. That's a right that, only 3 other states in the country are allowed to do: Maine, Vermont, and Puerto Rico. But the district is the only place that has a system in place that allows it to happen. And it's, at this time, that the time right now where out, so much is going into muffling out the vote. That's something I thought I would also bring up. But again, that's enough out of me. I am available for any questions on what I just said. And again, I'm just excited today as I was 36 years ago. And I'm seeing a lot of the success, especially when you look at the, specific programs that are in place for formerly incarcerated. I'm talking about paralegal, the whole 9 yards. A person can go as far up the ladder as they want to. So with that, thanks for letting me share.
Thank you, Mr. Thornton. And really, I think it's great information about what the laws that actually exist, especially around ban the box. I'm not sure, how many folks know that those laws are in place and what they, what they can do to really support somebody's reentry and hopefully, keep them from any kind of discrimination. When you get the chance, it looks like we have a few questions in our Q&A box that you may be able to chat and answer while our next presenter goes. But
can I give out the phone number to the office as well?
Yeah, absolutely.
All right. The number for the DC Office on Human Rights is 202-727-4559, 202-727-4559, and we're located at 441 4th Street, Northwest, 570 North.
That sounds great, and you're welcome to put that in the chat as well in case anyone missed it.
Help with that one.
Oh, all right, sounds good. Thank you. And next we have someone else great joining us. We have the Deputy Director of Justice Grants at the Office of Victim Services and Justice Grants, OVSJG, Mr. Ransom Washington. Thank you for joining us, and jump in when you're ready.
Thank you. The slide, just a few slides I had. Thank you and good evening, everyone. My name is Ransom Washington Jr., and I'm the Deputy Director of Justice Grants at OVSJG. OVSJG is not a direct service provider. We do, however, provide local and federal grant funding to community organizations within DC who provide the direct services. Next slide. A lot of our funding goals are tied to improving public safety, enhancing justice administration, supporting crime victims, and also strengthening communities. Next slide. We have a plethora of service providers who provide direct reentry support services, and those include, among the more important, pre and post-release planning. And this is where the service providers develop comprehensive plans to support individuals before and after release from their correctional setting. There's also case management services, and the service providers implement again, kind of a comprehensive case management plan for community-based supports. And so the short version of this is that the providers are typically providing sort of a one-to-one support to help returning citizens navigate their release. There's also employment support where the service providers implement strategies designed to reduce barriers to employment and kind of increase job readiness. So that might just mean some help with resumes, role playing around interviewing. And then lastly, another service is staff training. And so the service providers just ensure adequate training for their staff to successfully implement services for justice involved individuals. And then there are a host of other reentry services that are listed as well around criminal genetic needs, progress monitoring, mental health, and substance abuse. Next slide. A few of our service providers offer some additional reentry services related to restorative justice mediation, peer-to-peer support, interim housing, and financial assistance as well. And next slide. And so by the numbers, we currently have around 24 providers who offer reentry services, and we have provided roughly 9.3 million to the community and have served over 10,000 returning citizens who receive the reentry services. And that is my time.
Well, thank you for sharing all of that information. I know I'm speaking for myself, but I don't think I realized how many, grants are available, how many nonprofits you all are funding, and the number of returning citizens that you're reaching in the community. It's quite a bit, and it's good for everyone to know that you're reaching that far out.
Yeah, it's a lot of work, but it's rewarding work.
That is great to hear. Well, thank you. Next up, we have from the Department of Employment Services, we have Dr. Jesse Sneed and Aaron Fisco.
Hey, good evening, everyone. My name is Dr. Sneed. I serve as the Interim Associate Director for the Division of State Initiatives here with the Department of Employment Services. Just want to talk about how we serve second. I know it's so many second chance, returning citizens, it's so many words like they stated. We often hear about sometimes that can be the hardest to serve, but at DSI, we have the pleasure to be able to serve, and we enjoy serving returning citizens. We are a second chance opportunity hub through the Department of Employment Services, and we have programs and partnerships through the Ready Center as well, and we have different host partners throughout the DMV. Our primary focus is our job readiness training. As you can see on the screen, we have the brochure. So you'll be able to see the different types of programming that we have under the umbrella of the Division of State Initiatives. But primarily we have on-the-job training for up to 5 months. We have a job readiness training portion. We also have a work experience where individuals that can come into the program, once they complete the job readiness training portion, they'll be able to go through certain topics, social emotional learning, attitude, belief systems. Once you complete that particular course or that 3 weeks of job readiness training, you will then transition to our work experience phase, where we have a plethora of host site agreements throughout the city with nonprofit, government, for-profit, government agencies, where those participants will be able to serve for up to 90 days at that work experience, where they have the opportunity to also be employed as well. So we also, like Mr. Boykin stated and Mr. King, we believe in outreach as well. So we have a partnership with the Ready Center and DOC, where we actually host some of our job readiness training cohorts at the Ready Center. We believe it's very important to serve beyond the reach of Minnesota Avenue, because at the end of the day, everyone needs an opportunity. And at DSI, that's what we strictly believe in. And once we have the pleasure to serve you, we have different components, different partnerships throughout the city. Like Mr. Shakir stated, with the Pivot Paralegal Program through Georgetown, we are, it's a pleasure to work with them as well. Partnerships like DC Water, our activator cohorts that we currently have, the partnerships that we have. So it's just a land of opportunity. Once you arrive to our American Job Center, you'll be able to take a full intake assessment. And if you want to come to the Project Empowerment or the DSI programs, you can just tell them, that you want to be referred to us, and we'll be able to best serve you. We have three American Job Centers throughout the city. You have North 899 North Capitol. You have one here on Minnesota Avenue, which is the headquarters, and one also at the Shannon Place in Southeast. And once you refer it over, we'll then be in contact with you. We will do our initial process, referral process, get you with our intake team, and then you'll be able to get started with us. But we are definitely excited to serve. This is what we do. And we just love to serve and be of service to those, because at the end of the day, every second, third chance for us, every time you walk through the door, it's a first chance and a first opportunity for something new and a new opportunity to change. And if you're willing and the participants are willing and they have a desire to do better, we're here to assist them with wraparound services, clothing referrals, housing referrals, just different partnerships that we have through DSI as well. We partner with the DMV as well to assist our customers that may need assistance with receiving some license assistance, just trying to get an ID card, partnerships with Martha's Table. So we just try to make sure we provide those wraparound services, because we know that, at the end of the day, the workforce is important. But also we know if you don't provide those wraparound services, it's a lot of people can keep a job, but our goal is how can we provide wraparound services they can sustain that job for over a long period of time. So for us, we just try to work with you, get you acclimated into the workforce. We meet you where you are, and then we're just excited to help you along your journey to make sure you're successful.
Thank you, and we're going to pass it over to Mr. Cisco.
Good evening, everybody. I'll be brief. I know it's getting kind of late. My name is Aaron Cisco. I'm the Associate Director for the District Infrastructure Academy, known as DCIA. We can go to the next slide. I'll just give you a brief overview of our programs that we offer. As everyone know, that we were created under Mayor Bowser. One of her biggest initiatives for pathways into the middle class. We offer all of our residents some of the programs that are new to the District of Columbia. We're partnered with Washington Gas, DC Water, WMATA, and of course, Pepco. So some of the programs that we offer are straight pipelines into those organizations. Next slide, please. The Infrastructure Academy offers CDL, Class B, energy, utilities, energy, construction, and utilities. information technology, OSHA 10 and Flagger, and OSHA 30. Of course, with work readiness, we also have enhanced interview skills, as well as we provide direct job referrals from our programs. Next slide. We can skip this slide. So some of the programs that I just offered, I just dropped in the chat here, the flyer of all of the overview of all of our programs. Of course, our quick path to information technology, we offer the help desk training program, the Cisco networking security program, plus Security Plus. Our quick path to energy entails our PEPCO utility training program, our ECU program, which is energy construction and utility, our quick path to transportation, which is our commercial driver's license class B, as well as our elevator mechanic program that we created 2 years ago. And that's in direct partnership with WMATA. We also have quick path to health and safety, which is our OSHA, Flagger, and 10 program I just mentioned, as well as our CPR. Next slide. The program updates I'm happy to tell you about is that we are now into PEPCO 18 that just completed that will complete next week. We have just launched PEPCO 19. We're happy to say that we're on the pathway to the end of this summer of being able to say that we have put 350 district residents into direct jobs with that particular program itself. If many people know that we are moving into our new facility at the end of the summer called Spingarn. So we have a location here at 2201 Shannon Place on the 3rd floor, and we're opening our new location at Spingarn sometime in the latter part of August. We also have new programs that will be coming online after October, which would be our automotive technician program, drywall installer, welding, and a few more, as well as HVAC and plumbing. For any information that you have, you can also visit us at www.dcia.gov, or you can email us at dcia@dc.gov. Next slide. Our program offers weekly enrollment opportunities. We have Tuesday and Thursdays at 10 o'clock, an online information session for anybody to join to be able to learn about our programs and admissions and all the requirements. If you have any questions, you can reach out to us at any time. Our admissions team is always ready to stand by. You can also reach out to me. Once again, my name is Aaron Cisco. I'm the Associate Director of DCIA. My Director of Admissions is Mr. Zevlin Staten. That's it. And thank you for your time this evening.
Wow, thank you. And again, thank you to Dr. Jesse Sneed, to you, Mr. Cisco, as well. I think it's great to hear about, efforts being made directly from, the Department of Employment Services that are supporting the hiring, but also I think we heard a lot about training opportunities to receive credentials, opportunities to not just find employment, but find sustainable employment. That will help folks on their path to longer term careers. So again, thank you for your time. It was really great to hear about the resources that you all have available. And last but not least, I want to introduce the Senior Policy Advisor at the Office of Council Member Brooke Pinto, Miss Anaya Mitchell. Thank you for taking some time to join us. And I know it's late into the evening, but we do appreciate you sticking around to chat with us.
We saved the best for last. It's okay.
Exactly.
Good evening, everyone. Thank you, Adam, and thank you to the CJCC for the invitation to speak today on behalf of the Office of Councilmember Pinto and the DC Council. My name is Anaya Mitchell. I am the Senior Legislative Policy Advisor for the Committee on the Judiciary and Public Safety. And I also happen to cover returning citizens as a large part of my portfolio. So as chairwoman of the Council's Judiciary and Public Safety Committee, protecting reentry services is and has been a top priority for Councilmember Pinto. Creating rehabilitation pathways and setting people up for success in reentry is key to advancing all of our public safety goals. Too often, returning citizens face stigmas and barriers to getting employment and housing. And so, as such, as the legislative body of the DC government, we are working on creating new employment opportunities for returning citizens in the private and public sector with legislation like HOPE and HIRE that create incentives for public and private employers to hire more returning citizens. So just within the last year, we have introduced three major bills that directly target returning citizens. The first one is the Helping Incentivize Returning Citizen Employment Amendment Act, or HIRE Act of 2025. This bill would provide employers with a $5,000 tax credit annually per returning citizen that they hire in a full-term role. The bill would require a minimum employment of 90 days before an employer is eligible for this tax credit, but as soon as they surpass the 90-day mark, they would be eligible for the $5,000 per year tax credit per returning citizen that they hire. The bill would ensure that there is a lot of collaboration and strong oversight with the Department of Employment Services, who we've heard from earlier today, to make sure that we are appropriately managing reimbursements and compliance. Similarly, last year, Councilmember Pinto introduced the Fair Hiring Opportunities for Public Employment, or HOPE, Amendment Act of 2025, which would provide a hiring preference for individuals who have completed a district-facilitated transitional employment program, such as Project Empowerment, another program we've heard about earlier today. It would clarify the process by which criminal history reports are prepared and reviewed to ensure that only relevant information is reviewed on an application, and establish more objective criteria for evaluating criminal histories for employment suitability purposes. And the bill requires that should an applicant need assistance submitting a response to demonstrate rehabilitation, the applicant would be connected with community partner organizations that develop career development resources to help them complete the process. Lastly, the bill requires the program administrator and agency hiring coordinator to provide a formal writing to the applicant outlining the final denial, should there be a reason for the denial, and the steps to appeal the process if the applicant feels that it was unfair. It also requires DCHR to present an annual report to the DC Council about returning citizen hiring practices, hiring rates, and reasons for denial. And so we really, with these two bills, wanted to cover both the private and the public sector so that individuals who are returning can get government jobs and really build a steady government career if that's something that they want to do, or incentivize employers who are not in the government to really make sure that they're prioritizing and hiring returning citizens, because we all know that returning citizens are more than capable of doing the job. They just need the opportunities, right? It has already been noted several times today from other panelists, but one of the greatest challenges for returning citizens is finding stable housing. And so we are also working on expanding housing opportunities for formerly incarcerated people to help them succeed with legislation like the Project Homecoming Amendment Act. This bill creates a community-based reentry housing program that matches returning citizens with families, friends, or vetted independent homeowners, and offers them financial assistance, training, and case management services to support a successful reintegration. So what does this mean? This means that if you are a private family, friend, or a homeowner, you could receive up to $1,500 per month to house a returning citizen. How cool is that? We know that housing insecurity remains one of the greatest barriers to successful reentry. And so this bill is really exciting because it's a program that is already proven to work in states like California. They have the Homecoming Project, and it's essentially this, right? They have a matching system. Returning citizens would apply for the program, and then individuals who have a spare bedroom or a spare, open space in their basement or in their attic or anywhere that there's a large amount of space and you want to do something with it, you would be able to match with a returning citizen, provide that housing for them, get them stabilized, and then you would receive a monthly stipend in return for that. So it's very, very exciting program, and we're really excited to see that go through. We also know, though, that investments for returning citizens does not stop at legislation or bill drafting. It takes real financial investments into these initiatives to make them work. And so Councilmember Pinto's yearly budget request to the mayor reflects these needs. And this year, despite an extremely tight budget, the asks to the mayor were just as direct as they always have been. So one of the asks we specifically put in our letter to the mayor for this year's budget was to increase the housing vouchers that are available to returning citizens. We know that setting our returning citizens up for success to prevent homelessness puts them on a path to contribute strongly to our communities. We also asked for retained funding for the Access to Justice initiative, and I'm really excited that we were able to expand and sustain the program for the Access to Justice initiative, which helps low and moderate income district residents access legal support services and protections that they might need to mitigate long-term impacts such as eviction and unemployment. And this is a really important program, and we're really excited to continue working with OVSJG and all of the others who work with the ATJ initiative. Lastly, and most importantly, I would say, we included a funding ask to fund the council members' bill called Fresh Starts. This bill was incorporated as part of her Secure DC package, but it is now officially the law. The provisions in this bill invest in rehabilitation and successful reentry by requiring DOC to provide nutritional food and job training at the DC jail and ensure that there is a comprehensive plan for the new jail once it's developed. We understand that legislation does not happen in a silo, right? So I also want to conclude by just highlighting some council-wide priorities that relate to returning citizens, as well as what Councilmember Pinto has done to address them. So the Second Chance Amendment Act, which has been law now since 2023, has gone under some recent federal attacks, should I say. The Second Chance Amendment Act, for those who don't know, is a law that mandates automatic sealing for non-dangerous, convictions, as well as short waiting periods, before a person is eligible to seal their record. The original law was amended under Secure DC, and it had by motion aspects of the Second Chance Amendment being implemented on March 1st and automatic provisions being implemented by October 1st, 2027. Due to the inability of certain agencies to implement this with such a short timeline, Councilmember Pinto passed an emergency, temporary, and permanent legislation to ensure that all sealing provisions in the bill will be implemented by October 1st, 2027, not March 1st, 2025, last year. This timeline made it so that certain lesser offenses, including some offenses that had already previously been eligible for sealing for many years, would not become eligible until 2027 because they would not be eligible for automatic sealing, even though more serious offenses became eligible in 2025. So Councilmember Pinto's plan or emergency legislation fixed this by assuring that all offenses will be eligible at the same time, including automatic sealing and by motion sealing. Also this year, the council passed the Second Chance Clarification Emergency Amendment Act of 2025 to change the demarcation period from post-2023 to pre-October 1st, 2027. These are all just technical changes, but I just wanted to highlight that this is a council-wide priority. Even though the council member did introduce the emergency legislation, it was passed by the entire council. And it is something that I would argue is a top priority for all of the council members. Lastly, I just wanted to talk about some other issues that aren't necessarily legislation, but just things that we also focus on in this office. Number one is the halfway house. As we all know, DC does not currently have one. I personally toured the Baltimore halfway house and spoke to DC residents who were housed there. I heard their concerns. That's something that I am always willing to do and something that I hope to do again this year. And it's something that we are in constant contact with our partners and the BOP about when the solicitation is going to be finished and we can get the DC halfway house up and ready. The next deadline for the BOP solicitation is August 21st, 2026. And so I'm very eager to see if that solicitation will go forward. The last thing I want to highlight is the Unlock the Box movement. There's also a bill that was introduced by Councilmember Nadeau called Erase. This bill is something that is a hot topic. It's a bill that is currently in discussion with the council member. Our position at this time is that we do not support solitary confinement whatsoever. However, restrictive housing should be used very sparingly in very, very specific cases, and we are committed to working with the Department of Corrections to ensure that it is only being used in the most extreme, extenuous circumstances. And I'd be happy to talk to anyone about the erase bill if they are interested. Thank you again, Adam and the CJCC, for giving me the time to share some of our recent council updates. If you want to keep track of new or pending legislation, you can always visit brookpintodc.com or lims.gov, lims.gov, where we have an official record-keeping mechanism.
Thank you so much, Anaya. Just really great information about efforts that have passed, efforts that are being that are in progress, that you all are advocating for in the reentry space. I can already see in the Q&A chat function that you might have a few questions coming up, but I am going to bring back some of our other panelists so that we can do a little bit of Q&A before we jump off. Let's see. Well, so to get us started, the first question on here is what is the process for community-based organizations to partner and connect with you all to make the relevant referrals? I think this might be applicable to some of you and maybe not as much to others, but whoever wants to jump in to answer, please do so.
I'll start first. So for the Division of State Initiatives, this question is twofold. If a community-based organization, nonprofit, government, with the participants that we have with we send them to what we call host partners. So if your organization or organization that you know about, we have a job development team that will go out to see the space, any type of positions that you all have available, because for our participants, it's an internship for 90 days with the hopes of leading to full-time employment. So we can sign a whole site agreement. We'll pay the wage. We'll just sign a whole site agreement. We'll send our compliance team out just to view the space. Once we sign the whole site agreement, our participants can now then go intern up to 90 days at that particular host site.
Great.
Yep.
Cedric, I see your hand is raised. Do you want to jump in? You're currently muted.
No, Adam, I was just searching around the screen and hit the wrong spot.
Not a problem. Not a problem. Mr. Thornton, we actually have a question directed to you. It says, if the employer has eliminated the box but uses a background check as a way to block employment, what rights can the applicant seek with your office?
So, I mean, the right to come in and what the office will do is, take the information from that individual. And if the employer, first of all, if the box is on there, he's automatically violated the law and your right. If the offer is rescinded, then you get an opportunity to come into the office and, based on the information you provide, there can be a mediation. If we find that the offer was rescinded illegally, if it wasn't rationally related to the job that you sought, then we can pull that employer in and have a mediation. So, but the main thing is these are individual cases. So whenever you will even think that your rights have been violated, come into the office. Come into the office, and we have lawyers and as well as staff that can sit down with you, take your complaint, and let you know whether your right has been violated or not, and reach out to that employer and bring them to the office. One of the main things I say that we try to do, especially if a job was rescinded, is get that person that job, right? But you also had a right to damages. For example, if you got an application and it had the box on it, that employer is 100% in violation of the law. You bring that application in that you filled out, and you, the individual that brought it in, can receive damages up to $5,000. So again, it's individual basis, and you must come into the office to present your case. And you can get help in the office just from, speaking with the staff on whether you have a case or not.
That is great to hear. And, going off that question, and I think this question is for OHR, but I think it's also for DC Council as well. Is there any momentum or interest in expanding ban the box protections? Our attendee asked, they said the absence of asking about criminal background is good at the time of an application, but many returning citizens are devastated by a conditional job offer being rescinded, especially when employers can come up with other pretextual reasons to rescind a conditional offer. So I think the question really, again, is there any momentum to expand ban the box protections?
From where I'm sitting in the office and from my interaction with, most of the returning citizen population in the city, I have not seen a lot of momentum in expanding it. But what I have seen, as was mentioned, in the question, is the rescinding of office. I mean, it has even gotten to the point where there are, the BOP, and Fairview, as well as Volunteers of America, our residential reentry centers, have, notified employers and let employers know that this individual can't work that job, which, in my opinion, is a violation for the very people that supposed to be providing reentry services, BOP, RRC, for someone to go out and get a job and then have the institution say that they can't work that job. That's a big issue, and I'm seeing that more than anything else. If there's people on this call that want to come together and begin to, look at how to address these issues, I'll give you my number. My number is 202-246-3823. That's my cell. And I think this is a good time to try to create the momentum.
All right, we have, it looks like one more question here. Regarding solitary confinement, what is DOC's current stance or position on the use of solitary confinement at the jail? And is there any willingness on their part to address this? I don't believe we have any, direct representatives from DOC to speak to that, but is there anything else anyone wants to add in that category? Anaya, I know you talked a little bit about solitary confinement, so if you have any thoughts in that area, but also up to you.
Yeah. I certainly won't speak for DOC, but in talking with them, they have made it very clear that they do not practice solitary confinement. like as the term solitary confinement. What DOC does is they have what's called restrictive and administrative housing. And so that means that essentially, if you got into a fight with someone, you would then be placed in a unit where you would have limited open access to the facility. There are also certain circumstances where a person can request to be in restrictive housing if they don't feel safe in the housing unit they're in. They also have like medical restrictive housing. So if you need to be sent away because you have a contagious thing going on. And so I won't speak to whether DOC is willing or not to improve that, but I will say that that has been a topic of many of our hearings with DOC, and it is something that we continue to discuss with them often.
Mr. Boykin, I see your hand is up. If you are saying something, we cannot hear you. All right. Well, thank you. Thank you, Anaya. And I want to thank everyone who came to today's webinar. I know this has been a long session. I know it's 8 p.m. on the East Coast, at least on a Tuesday night. But really, thank you to our panelists. Thank you to all the work that you're doing in these various DC agencies to support reentry. Whether it's in employment, healthcare, helping them acquire IDs, finding employment opportunities. Fighting against discrimination, so many great different opportunities and supports that you all are providing. Thank you to our audience tonight for taking the time to be here to hear about the services. We'll have more CJCC events in the future, and I hope that you all will join us. When you sign off, you will receive a survey that will ask you a few questions. Please do fill out that survey. It really does help us understand if what you're gaining from these webinars, what you're gaining from these sessions, and opportunities for different topics and areas of interest that will benefit you all, especially obviously in the criminal justice space. But thank you everyone, and have a great evening.
All right. Thank you, Adam, and everyone else.
Thank you, Adam.